I arrive on scene to a patient who is experiencing chest pain. I make sure that the scene is safe and that I have gloves on and additional BSI depending on the situation. Once I talk to the patient, I find out that they've been experiencing chest pain most of the day. They took a dose of nitroglycerin earlier in the day, but their chest pain is not reduced. So I'm going to go ahead and check with medical control to see whether or not it's appropriate to give this patient additional nitroglycerin. And when I do so, I need to check a couple things. I need to check to see whether or not there are any contraindications, if the patient has taken any sexual enhancement drugs, such as Viagra, that might counteract the effects of this and actually send them into a worse state than they currently are. And double check with medical control to see if there are any other contraindications. Then we're going to check all the patient rights. So we're going to make sure it's the right patient, we're going to make sure it's the right medication, that it is the right dose, that is going via the right route, and we're going to explain to the patient, if they don't know already, the importance of taking nitroglycerin sublingually rather than chewing or just swallowing it, and get them to understand that that's very important to get the medication working quickly in their system, and that's one of the fastest ways that it can actually deliver the medication to themselves. We are also going to make sure that we have the right time and that we have the right documentation. So we're going to double check that the prescription is actually the correct prescription for the patient, double check the doctor who prescribed it, again check the dose, and ensure that we have written down what time the patient took the medication at, so when we pass them off to higher care, that the hospital staff knows exactly what time, how much, and via what route the patient took. We are going to transport the patient because there's nothing much else I can do as an EMT about chest pain. And while we're en route, I'm going to continue reassessing every 5 minutes because this is a very serious thing.